They're brushing past each other in a small shop. They don't know each other's names.
This variant of concern will become uncontrollable and people will die.
The language used to describe the Kappa strain of COVID paints an alarming picture.
We're neck and neck with this virus and it's an absolute beast.
But according to some Aussie experts, things are not so black and white.
It doesn't look more infectious than the UK strain. It hasn't taken off in the UK in the same way that the other Delta strain has that's come out of India. So if it's anything, it's on a par, but it might actually be not quite as infectious as that UK strain.
It's a seemingly rare example of differing opinions among the pandemic pros.
It certainly does appear that this strain is more infectious than the Alpha strain, or the previously referred to as the UK strain, which was likely around 50% more infectious than perhaps the original strain.
It is more infectious in the sense that more people get infected for every case, so I think that's accurate to say that.
The fact is, judging the infectiousness of a new strain is difficult, partly due to our own behaviour. Kappa's spread through India made it seem extremely infectious because of things like population density. In Australia, the same variant may move no faster than other strains, thanks to social distancing and the latest Vic lockdown.
It's really hard to assess sometimes the infectiousness and speed of spread when you're first unpacking an outbreak. It actually is the devil we know, but when the outbreak is small, we can still contain this. And that's the important message out of all of this.
I think the communication is really challenging. We certainly don't want to unduly alarm people, but I think it's really important we communicate that there is a significant risk of this virus in this country.
But faced with concerns about complacency, could a little alarmism actually be good for us?
Professor Tony Blakely is an epidemiologist who joins us now. Tony, what's your view on this? Is this strain significantly more infectious than others or not?
Than most, yes. And I agree with all the things the previous speakers said, but let's try and clear up some stuff here. Last year, I would have passed it on to 2.5 people on average if I was in a pre-COVID world. This one is about 4 people I'd pass it on to, which is perhaps a little bit more infectious than the UK variant here, Kappa here, but less infectious than the Delta, which is the one going around in India. So it's at least 50%, probably not as much as 100% more infectious than the wild type we had last year. That's how I see it, and that's what the international evidence suggests.
Professor, the language used around this Kappa strain is so emotive and has been accused of being fear-mongering even. Is there a danger in using terms like this is a beast or referring to how much more infectious this Kappa strain is than previous strains? Is there a touch of boy cried wolf complacency that we're asking for from people who can't live in a constant state of fear?
Well, okay, the first thing here is risk communication is really hard. If you read through the transcripts or look at all of the press conferences with Brett, Jerome and other people, they mention all the stuff and things like the beast is said and it gets picked up. It is more infectious, but it is not a Frankenstein virus. The same sort of measures that we used last year will work now, but they'll take longer and need to be more intense. So, for example, a lockdown in New South Wales, the way they did it last year, slow in, slow out, rely on contact tracing, would probably not work with the current variant. They'll need to do things a bit more aggressively, which is what we're seeing now. Nevertheless, the tools we have in our toolkit will still work. It just requires amping them up a little bit.
Tony, we're hearing tonight that 2 of these fleeting transmission cases are being reclassified as false positives. Does that change things at all?
Yeah, it's never a dull moment with COVID, is there? It does change things a little bit. And that's, I don't know, something like a third of the fleeting transmissions appear to have not been a transmission at all. That still means there are other ones happening. We're still seeing this virus transfer from one person to another person in instances that we wouldn't have normally expected. But the other thing is that our contact tracing is so much better now that we're seeing these transmissions that we wouldn't even known about last year and we would have just called them a mystery case. So the false positives, they happen, and I think actually the transparency with which the Victorian government has quickly released that information is great. And false positives happen.
But it means that the numbers aren't as bad as we might have thought. So if these fleeting transmissions are false, is there a chance that Victoria didn't need to extend the lockdown?
Okay, a couple of the fleeting transmissions may not have happened, but others have. So let's not jump too far with that logic. But I agree with you that that makes the numbers look a little bit better. I'm personally of the view, and maybe it's because I'm a Victorian, I want to get out of lockdown, is that we may not need the full 7 days. I think our contact tracing is doing extremely well as long as the future cases we see are occurring amongst those contacts we've already isolated. I reckon we can get out of this before a week, but we still need at least a few more days.
Tony, I like that you're a Victorian now. The other night when something you were laughing at was going on, you said you're a Kiwi. So that's very generous of you.
I pick and choose as I wish.
Yeah, really, and that is your prerogative.
He wants to be a Victorian in bad times.
Well, yeah, sometimes. Thanks, mate. Good to talk.
See ya.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.